Hello, good evening. We got it. All right. Thank you very much. So, for those of you who don't know me, my name is Gary Pundt, and I'm going to give a speech tonight on dentistry, which is an exciting topic, I can tell. When Pastor Vitali asked me to give a presentation a week or so ago, I had every excuse in my mind why I shouldn't be right here, right now. And I told him all those reasons, and I actually said thank you, but no thank you. My forte is more helping out with the sound and video and behind-the-scenes things. And I actually said no, but then, you know what, the Lord works fast, because a few minutes later I texted him and said, Pastor, I'll do it. I don't know how, but I'll do it. And so pray for me, because I'm a little nervous. But anyways, thank you all for this opportunity. Thank you, Pastor, for the opportunity. I wanted to give a little bit of background about where I started in dentistry and kind of my passion in dentistry, and then we'll talk about a specific topic of dentistry. So I attended dental school at Loma Linda, California, in Southern California. Their mission statement says that, well, actually, their mission statement, Loma Linda University is a Seventh-day Adventist Christian health sciences institution, and they seek to further the healing and teaching ministry of Jesus Christ to make man whole. Part of that ministry is, they say, we seek to serve a worldwide community by promoting healthful living, caring for the sick, and sharing the good news of a loving God. Part of the university is obviously the School of Dentistry, and their motto is, service is our calling. Their mission statement at Loma Linda School of Dentistry says that they seek to further the healing and teaching ministry of Jesus Christ. And that's what kind of grabbed me when I was in school, to follow that avenue, and it really kind of became the passion of what I do in dentistry, to serve others. And while I was in dental school, I actually got to go on a few mission trips, and that's where I really grabbed a hold of wanting to serve through doing dentistry. So with the motto of service is our calling, I got to go on several mission trips throughout the world. The first one is actually in Veracruz, Mexico, and I'll just run through these real quickly. Loreto, Mexico. We got to visit Nicaragua a few times, over to Turks and Caicos. And those were just while I was in school. After school, I revisited several of these places, back to Turks and Caicos, Nicaragua several times, and into a very awesome island of St. Kitts over in the Caribbean. And when we're able to do these kind of mission work trips, it's just very, very rewarding. To see the people that you can serve, and you can give them dentistry that they might not otherwise have access to care. My wife and I got to go to St. Kitts, and we worked out of this little dental office right here. This is the SDA dental clinic there. It's run by a dentist, so we spent a little bit of time there while they were on vacation, and kept the clinic running. And it's not a bad place to hang out and travel too. So tonight I wanted to kind of touch on a couple of topics that I come across in dentistry that kind of doesn't make sense, but when you see these things, I wanted to see what your thoughts were on them. So one of the first topics were, they're just baby teeth. They don't need to be fixed. What do you guys think about this? Are baby teeth important? Absolutely. The truth about this is, baby teeth can cause pain if they get cavities, or they can cause infections. In fact, there's a whole specialty in dentistry devoted to treating children called pediatric dentistry. Infections for baby teeth may cause early problems with biting and chewing functions, which later can cause improper nutrition. It affects the growth and development of their jaw. Early loss of baby teeth can cause the other teeth to start drifting and crowding, which will cause more problems with the adult teeth later. So absolutely, this is busted. So baby teeth are definitely important. Another topic. Have you ever heard of this one? If I have a toothache, placing an aspirin tablet next to the tooth will relieve the pain. You ever heard of this stuff? An old wives' tale, I guess? I don't know. Yeah? So what do you think? Is this true or not true?
We tried it.
Tried it, yeah, and a lot of people try it. That's what I'm saying. I see this quite often. A lot of dentists see this. And the truth is, at-home toothache remedies really won't correct the dental problem. They may mask the pain a little bit. You'd probably get more benefit from just swallowing that aspirin than putting it on the gums. The problem is it can create a really painful chemical burn on the gums, and that usually is a bigger problem to actually fix and try to heal from later. So I think this statement has also been busted, so. Don't brush or floss bleeding gums. Do you think that's a good idea? I think we're on a trend. The truth is, healthy gums don't bleed. The bleeding comes from when food debris and plaque accumulate on the teeth and the gums become inflamed. It could also be from improper brushing or flossing techniques. Infrequent brushing or flossing. If we never brush or floss our teeth, I'm sure our gums will bleed. And then consistent bleeding gums may be a sign of something bigger, a more serious dental problem, which is what I wanted to focus a little bit on tonight. So I think this myth has also, there's my little disclaimer, see your dentist if there is a problem. Busted. All right. So why do gums bleed? What can we do about it? What is gum disease? Can it be treated? Let's jump into that really quickly. First of all, I wanted to kind of talk about the word gum disease, and kind of the more dental word that you may hear is periodontal disease. Basically, it's just a simple breakdown of peri meaning around and dontal meaning teeth, so a disease around the teeth, which involves the gums and the bone that holds the teeth into our jaw. You also hear a word called periodontitis. This is basically meaning inflammation of the tissues around the teeth. So now that we have this fancy word, I'm going to be saying it a lot tonight. So now we're on the same page. Periodontal disease. What are some signs and symptoms of periodontal disease? Have you ever noticed someone having bad breath that just won't go away? Not the person, but the bad breath. Red or swollen gums. Tender bleeding gums. Gums that bleed when you brush or floss. Painful chewing, receding gums that appear longer or sometimes loose teeth. These are all signs and symptoms. These are kind of a general breakdown of periodontal disease, starting at the early stages of gingivitis. We've all heard of gingivitis, and on to early, moderate, or severe periodontitis. And on the diagram, what you can see is this is some healthy gum tissue where the bone support is good, the gums they're good, and the pink gums look healthy around the teeth. And the coloration, a little bit off, but you can kind of see the gums start to get a little more red, a little pink around the edges, a little more inflamed looking. And then this is a pretty severe case where there's a lot of calculus and tartar at the gum line. And what we can see in the diagram is that bone support level starts to drop, and that's how the teeth can get loose, and you can actually lose teeth due to that. Are pictures okay? You guys okay with pictures? We're going to have some more pictures in a second. So what causes it? Plaque. You've heard of plaque. That's the sticky film that sticks to the teeth when we eat foods. That plaque has millions of bacteria, and those byproducts of the bacteria is what causes tooth decay and gum disease. That can only be removed by brushing. Once that plaque sticks to the teeth, even after a few hours, it can stick to the teeth where brushing alone won't remove it, and that's where it's called tartar or calculus. And really, the tartar or calculus can only be removed by a dental cleaning. Here's another diagram. When you get your dental cleaning and dental checkups, it's really important that these measurements are taken around the teeth. This is a little periodontal probe. It's a little ruler that measures the gum attachments around the teeth. And you can see if those measurements get between 3 millimeters, actually 4 millimeters or higher, we're in an area of moderate to severe periodontal disease. And that's also where the bone levels start to drop and the teeth can get very loose. Here's a picture. We said we're okay with pictures, so here's a picture. Hopefully nobody's going to get woozy or passing out here. We don't need anything. So here's some healthy gums, healthy teeth. Here's some not so healthy teeth and gums. The reason is this has severe periodontal disease under the gums. So you can see how we're talking earlier, the teeth appear longer. They're probably loose. The recession of the gums. The corresponding radiographs show very good bone support here and not so good bone support here. The bone levels are very low around all the teeth. These teeth are probably very mobile and probably won't be able to be saved or treated. You can actually see a little periodontal abscess around that tooth right there. So definitely important to keep the teeth clean and healthy. This diagram I put up here, this is very alarming, and I wanted to just kind of bring awareness to gum disease tonight. A recent study from the American Academy of Periodontology says that almost half of the United States has some form of periodontal disease. Mild, moderate, severe, but almost half of this, and this is in adults aged 30 years and older. When the population is over 65, that percentage jumps to 75%. So if you can imagine, over half the people in this room right now have some form of periodontal disease. In this country right now has some form of periodontal disease. It's very alarming, and we should be aware of it and take the steps to correct it and prevent it. So I was pretty impressed when I saw that number. I really didn't know that number was that high, but that's what it is. So how is it treated? First of all, get a thorough assessment from your dentist and dental hygienist with x-rays, with gum measurements, and then come up with a plan. What is the plan of treatment for your teeth? Usually involves some type of cleaning called scaling or root planing. This is a more involved cleaning that helps clean out the bacteria, clean the teeth, clean the gums, and stop that progress of gum disease. In more advanced situations, a periodontist is sometimes involved, and these are gum specialists. This is a dentist who's had extra training, extra specialty treatment, or education to treat periodontal disease and other aspects of periodontal disease, such as dental implants, etc. And then a really important thing is follow-up care. After periodontal treatments, an average is 3 months periodontal care, and that's to prevent that periodontal status from coming back with your teeth and gums. How can it be prevented? Of course, good brushing. Brush, 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 2 to 3 times a day. Flossing, cleaning between the teeth where the toothbrush can't reach. It's definitely important. Eating a healthy, well-balanced diet. Limiting between meal snacks. See your dentist and hygienist regularly, on average every 6 months, but that, like we said, that can be adjusted for your particular needs. Get x-rays yearly to monitor the bone levels and calculus support or calculus buildup around the teeth. And hold your dentist and hygienist accountable. Ask them next time you're in, what are my gums looking like? What are the measurements around my teeth? Do I have periodontal disease? How is it looking? Be aware, and these are good steps to take. And of course, one of the risk factors is smoking, so we recommend not smoking. You don't have to brush all your teeth, just the ones you want to keep. So I challenge you, and I encourage you, keep your bodies healthy, keep your mouth healthy, keep your gums and teeth healthy. This verse really stood out to me. Whatever you do, work at it with all your heart, as working for the Lord, not for human masters, since you know that you will receive an inheritance from the Lord as a reward. It is the Lord Christ you are serving. And our bodies are the temple of God, right? We want to keep our bodies healthy and clean. And I encourage you also, whatever your gifts and talents are, use those for the glory of God. This is where this verse stands out to me. So whether you eat or drink, or whatever you do it for the glory of God. God will present opportunities to you, and when those doors open, walk through those doors. I encourage you. In fact, don't walk, run through those doors. You won't be disappointed, because our reward is not in this earthly home. Our reward is in our heavenly home. Amen? All right.